Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Living with a chronic skin condition is more than just a physical problem. Today we're going to learn about how to take care of your skin and what to do if you ever discover a problem. My guest today is Dr. Raj Chovatiya, a board-certified dermatologist and founder and director of the Center for Medical Dermatology and Immunology research in Chicago. His area of clinical focus includes chronic inflammatory skin disorders. He published numerous abstracts and manuscripts and has been recognized for his contributions as speaker, researcher, and leader at national and international conferences. Dr. Chovatiya, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. It's a pleasure to have you.
Thanks so much for inviting me. It's a pleasure to be here.
So tell me a little bit more about yourself and why did you decide to become a dermatologist?
Great question. And one that a lot of younger aspiring derms or even medical students ask me too. And it's kind of funny to look back on things because I probably never would have said dermatology was the medical specialty that I was going to choose if you had asked me in undergrad or even medical school. And it was really during my time in graduate school while getting my PhD where I learned a lot about basic immunology, and in particular, a lot of the big questions we still had about skin disease, an organ that we all see every day, but had very few good treatments for very burdensome diseases that maybe weren't necessarily life or death, but incredibly burdensome for quality of life. And these are the big diseases we think about like eczema, psoriasis, alopecia, and others. And the more I read and the more I learned, I realized that there was just such opportunity to really make a path in terms of clinical care and research. And that's what really drew me in and has really been the defining part of my career since.
So the largest organ in the body, why do you think we need to go to see you or dermatologist?
Well, aside from my charming personality, I mean, I think that, skin can look a lot, like skin problems can look very different from one another. And it's really hard to recognize just because things can look so similar and yet they could be concerning and not concerning. And really a board certified dermatologist is going to be the person that you want to go to for any issues that deal with the hair, skin, or nails that maybe don't seem completely normal or out of the ordinary. And we have a way oftentimes of saying our problems aren't that big of a deal. We don't need to see somebody about it. But I highly encourage all of my patients, if you see something that doesn't look right or feels right or is giving you symptoms that are out of the ordinary, it's very simple to just get in touch with a dermatologist and get an appointment, because even if it is nothing, you want to make sure that you get somebody to check it out.
So what is the most common problem that you see in your office as a dermatologist?
Well, there's a whole host of diseases that, individuals can come in with. I, of course, have a specialty in chronic inflammatory skin diseases. And that includes a variety of disorders, including the one that we're kind of partnering with to talk about today in the case of seborrheic dermatitis. And this is a really common disorder that many individuals have, but may not necessarily recognize the symptoms. And therefore, it can take years for them to seek out a healthcare provider to receive a diagnosis.
So what does seborrheic dermatitis look like? Is it red? I mean, there are a million rashes. There are a million red areas on your body. And how do you differentiate this skin condition from others?
Yeah, it's a great question. And, patients commonly ask, a lot of rashes can seem red or itchy or scaly. And how does one differ from the other? So in the case of seborrheic dermatitis, this is a chronic and recurrent inflammatory disorder that typically causes red or pink patches with large, greasy, flaking yellow scales and persistent itch. And it's really the combination of these signs and symptoms that lead to a major quality of life burden. And, the symptoms of seborrheic dermatitis are visible. So it's really oftentimes associated with social stigma, negative self-image, low self-esteem. And, this is one of the reasons why I'm really passionate about thinking, treating, and researching in this disease. It affects almost 10 million people in the US, but a lot of people don't recognize the symptoms. And it can take a lot of years to seek out somebody to give you the right diagnosis. And that's why I'm actually really excited to partner with Arcutis to raise awareness of seborrheic dermatitis and a new treatment option in the case of ZORYVE foam.
So seborrheic dermatitis, is it most commonly seen in your teens, in your middle age, or your older adults? Where are you seeing this?
Yeah, seborrheic dermatitis can affect all ages, actually, throughout childhood, adolescence, and adulthood. And just given the sheer number of individuals that are affected and how common it is very interesting that, a lot of folks haven't necessarily heard about it, which is another reason why having a dermatologist on board can be really helpful for education and talking about the disease.
So when your patient comes in with this skin condition, what are the first things you do to diagnose it?
Yeah. So, in the case of dermatology, a lot of what we do is based on the medical history and physical exam. And that's a big part of what we do. And sort of I mentioned that, we're typically looking for the rash in terms of the red areas with those greasy, flaky scales, oftentimes on the scalp, face, back, or chest. It's important to note that the rash itself can look different in different individuals with different skin tones. For somebody skin tone like myself, for instance, It may not look red and pink. It might actually look slightly darker or more purple in color, but they're all clear signs of inflammation. The other point that I like to try to tell folks is that once we're walking through and feel good about the diagnosis is assuring them that, it's not a contagious disease. And that's a really big misconception that we have. And, it oftentimes is challenging with individuals' history of treatment as well, because I have to prescribe oftentimes multiple products for my patients for this condition to use on the different parts of their body. I mentioned the scalp, the face, the chest, the body folds, each with different lengths of time. And this whole thing can make the situation quite complicated. And given that seborrheic dermatitis can oftentimes involve hair-bearing areas, topical medications like creams, gels, and ointments are not so easy based on individuals' hair types as well. And so historically, people just haven't been that satisfied with their treatment options.
So the treatment option would be an oral prescription?
No, so typically it's going to be topical medications. So you're going to be thinking about creams, gels, ointments, and medications like that. But the exciting thing is, for the first time in 20 years, we have a first-in-class prescription topical foam that's actually been approved by the FDA specifically for the treatment of seborrheic dermatitis.
And what classification of medication is this? This is anti-inflammatory? What kind is it?
Yeah, so this is a medication that does target a specific source of inflammation caused by seborrheic dermatitis, a specific enzyme called phosphodiesterase 4, ZORYVE, or roflumilast topical foam, 0.3%. It's available for the treatment of seborrheic dermatitis in adults and children, 9 and up. And it's a foam that's water-based, it's fragrance-free, no common irritants. And it's really important because in the clinical trials in which it was studied across several hundred individuals, we found that about 77% of individuals had clear or almost clear skin with this specific medication at 8 weeks, compared to only about half used the foam without the medication. And the most common side effects that were seen included common cold, nausea, and headache.
So how do you make the distinction between this condition and eczema?
Yeah. So, when we think about seborrheic dermatitis, again, a lot of this is going to be based on just your years of expertise in dermatology. And typically you're going to be thinking about some of those signs and symptoms that I mentioned. Itch, along with redness or pinkness and the flaking or scaling in specific parts of the body, oftentimes the scalp, face, eyebrows, behind the ears, the cheeks, the beard area, also the chest, and even the body folds too. And so when you put all that together, that's how you get to a diagnosis of seborrheic dermatitis.
So how does that differ from eczema?
Yeah, so eczema is actually a larger term that we use to describe a collection of diseases.
Okay.
And eczema colloquially oftentimes refers to a disease called atopic dermatitis, which is one condition. And seborrheic dermatitis can be considered by some to be also in a larger family of eczematous disorders, but again, distinct than what people typically call eczema.
Is this particular condition familial? Do you see it running in families, or is it atypical? It just happens?
Yeah, an area of active research that we don't necessarily have a lot of answers for, but we do know that, individuals across a lot of different inflammatory diseases can potentially present with stuff and their family members can present with as well. So there's often a historical component, but probably too early to tell. But just given how common it is, I think the bigger point that sort of we're all trying to get across in the community is whether or not you feel like anyone in the family has these symptoms, if you feel that, you specifically have rashes that sound like this in certain body areas, been dealing with this for a long time, have symptoms like itch and flaking, really talking to your healthcare provider, particularly in the case of dermatology, is an important part. And there's actually a lot of information too available online. We know that there's a wide spectrum. And in the case of, we're talking about Zoryve or Zoryve foam today, Zoryve.com is one place where you can read more about some of the prescribing information that I talked about, but also important safety information and disease-related information about seborrheic dermatitis itself.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about how to take better care of your skin and what to do if you ever discover a problem. My guest today is Dr. Raj Chovatiya, and he is a board-certified dermatologist and the founder and director of the Center for Medical Dermatology and Immunology Research in Chicago. So just changing it up a little bit, I know that we're seeing a lot of the sun. How can we protect our skin? Sunscreen, what do you think? 30, what is 15? What are some of your suggestions?
Yeah, so in general, really good solid skin protection is going to be an important part of your normal health regimen as well. And of course, maybe this relates a little less to seborrheic dermatitis, but in the case of sun protection, typically SPF 30 or higher containing sunscreens that are applied every couple of hours that you're going to be out in the sun is one part of an overall healthy strategy. Right. I also tell folks that, even regularly seeing your dermatologist as well, of course, for some of the specific issues we're talking about today, but in general is always a good idea for ensuring good skin health too.
So if I am darker complected, can that eliminate me from using as much sunscreen because of my melanin?
Another good question. So the short answer would be no. So we know that all skin types, whether light to dark, would require really good sun protection, in part because sun is really important stimulus, not only for skin cancer risk, but also the signs of aging with wrinkling and atrophy and changes in pigmentation too. So the full spectrum of light, UV and visible light as well, can all cause changes to our skin that we don't necessarily want.
Do you, I know studies have shown, I'm sure research is saying that the UV light is worsening as the years transpire. And why is that so? And why is the skin more at risk now with the sun, that direct sun?
Another good question, and maybe one that's perhaps a little beyond sort of the time necessarily we have today in terms of the research, but part of that probably relates to sort of various aspects in terms of the environment, plus individuals' own protection habits as well. But if I can sort of just generally, bring it back for just a moment and say that, I really do want to emphasize for folks that we oftentimes think about skin as being, the most important organ at risk for skin cancers and sun and aging. But it's really some of these chronic diseases like seborrheic dermatitis that individuals really don't end up coming in for, even if they do come in for sun screening. And just kind of important for individuals to remember that dermatologists kind of do see it all. And we do have options for some of these diseases that aren't related just to sun protection at baseline, just like we were talking about with Zoryve foam today.
So just giving you, I know as a dermatologist, you have a broad knowledge base. What is the link between stress and skin conditions? Is there a link?
Yeah, so stress is a very general term that we use in medicine all the time that probably is a combination of psychology plus actual activation of hormones and the adrenocortical axis. And of course, so sort of tied back in the case of seborrheic dermatitis, patients talk about many different triggers for their disease, and stress is one of several different ones people will mention. But people oftentimes talk about stress in general as an important part of a lot of their disease activity as far as the skin goes. So, it's easy to tell somebody, hey, stop stressing and things will be better. And It's probably a little more complicated than that. But in general, I think it's important to note that if we're trying to think about treating the whole individual, there are so many interconnected systems in the body. When we think about the brain, when we think about organs, when we think about hormones, we think about skin, that there's a lot of components that just generally go into an overall healthy life. And stress, its multifactorial components aside, is one part.
And how do we make the distinction between, okay, this is a normal aging process versus this is a real problem? You know, my skin is aging, but now this looks like something, maybe hyperpigmentation in a particular area. How did I make that? Should I make that distinction? And if I do see something like that, do I make an appointment to come and be seen?
Correct. Yeah. So it's a good point. And I think that patients oftentimes come in hesitant, thinking like, I'm not sure if this was a good reason to come in or not come. And I always tell individuals, number one, there's never a bad reason. So if my job is obviously to ascertain what's going on in the skin, like that's what I'm here for. It would be like, you know, me not wanting to come in for something that was outside of my expertise. I know what my limitations are. So typically, if there's going to be signs and symptoms on your skin that just generally don't seem normal to you. So if we tie it back to seborrheic dermatitis, we talked about flaking, redness, itch in certain parts of the body. If we were talking about, of course, changes in pigmentation that definitely don't seem normal as well, or changes in pre-existing areas that just does not look like the other skin around it, those are all reasons enough to go seek out your dermatologist and really try to figure out what might be going on.
Because I know that in women, we do experience hormonal changes. And as we go through hormonal changes between menopause and childbearing, these types of stages in your life, your skin changes. So the mere fact that your skin does change, does that necessitate a visit to the dermatology, or should you just say, I expect that I'm going to have this dark pigmentation on my abdomen, or, you know, I'm going to have these maybe dark circles under my eyes because this is what I'm going through, or, you know, here it is going to the dermatologist to see why this is occurring. You know, I don't know what your suggestions would be.
Yeah. So, you know, the body doesn't necessarily read textbooks. So even if you sort of try to do a good job of researching what should or shouldn't be happening, again, without sort of the specific expertise, it's tough. And so to your point, there are situations where people can have pigmentary changes that are a normal part of physiology. There's also situations where that's not going to be completely normal as well. In the case of our initial discussion, like I said, related to rashes like seborrheic dermatitis, usually when you do have symptoms like itch or changes in terms of redness, swelling, or even flaking, that's typically not normal as well, and not just a part of sort of who you are. Right. So I think that even if you think that it might be relatively normal, the threshold is low enough that visiting somebody qualified to have that discussion is important, because it can be hard to sift through the things that are just related to normal life, normal aging, normal sun, versus the ones that may necessitate further workup and potentially treatment.
So you talk about the seborrheic dermatitis and it occurring in the scalp. I know a lot of dandruff. You know, you may experience dandruff, you know, with the flaking of the epithelial, you know, layer of the skin. Does it look like that? Because dandruff can really appear that once you take away that flaking area, it's red underneath. Does it look like that, or is it just a little different?
Sure. Yeah. Dandruff typically describes some of that flaking that you mentioned, usually in the absence of some of the specific signs and symptoms that we're talking about. In the case of seborrheic dermatitis, usually you're going to see overt signs of inflammation. So if there is any kind of redness or pinkness or change in tone, any kind of associated swelling, scaling, excessive itch or changes in sensation, that would be reasonable criteria enough to actually make the diagnosis of seborrheic dermatitis and potentially talk about treatments like Zoryve foam, especially given in the scalp. And this is one of the trickiest parts historically. Right. For years, you know, our topical options like creams, gels, and ointments are really hard, particularly for people that might have thick hair, people that may not necessarily wash their hair that often, diverse hair care practices too. And so, you know, patients historically have just never been satisfied with scalp related treatment options or just treatment options in general, in large part because of that. And so that's actually one exciting part about the discussion in the case of Zoryve foam, because it actually is a water-based foam that's fragrance-free without common irritants. So it, in many ways, has formulation that's designed to make it easy to apply to the scalp along with other body areas.
So the seborrheic dermatitis, is there anything we could do with our diet to help to reduce this inflammatory response?
Yeah, it's a general question we ask a lot in dermatology, and one that there's active research, but no real conclusive answers. And I tell my patients that Obviously, living a healthy lifestyle is an important part of anything that you do. But I think the most important part is once we sort of see the condition itself, we want to treat it. Mm-hmm. And I think that, that's where something like roflumilast or Zoryve comes in. The question about diet is a good one, but one that probably is maybe a bit beyond our discussion here too, but a lot of questions, maybe more so than there are answers.
And one last thing, I'm wondering, with this inflammatory response in the body, are there any triggers that make it worse? Maybe if I'm around something that I'm allergic to, is it worse in the condition?
Yeah. So, when we think about a condition like seborrheic dermatitis, it's typically related to inflammation that's coming within the skin itself. Right. So it's distinct from an allergic contact dermatitis where there's a true specific allergy to a product itself. Okay. Now, my patients will oftentimes talk about a variety of different flares that they have for the disease. Some people, they're going to say maybe it's when the temperature changes, maybe it's humidity, maybe it's stress and whatnot. And I think that's all very helpful information. But I think that, independent of all of that, if I can make the diagnosis, then the next step is really going to be trying to connect my patient to the right treatments. And then typically that's going to be targeting the specific source of inflammation rather than specific avoidance of anything.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about how to take better care of your skin and what to do if you ever discover a problem. My guest today is Dr. Raj Chovatiya, a board-certified dermatologist and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago. So a little bit off of our typical conversation, we're going to ask you something else. What would you say is very, very important in just regular skincare, everyday skincare for an average person? Is it washing with soap? No soap on the skin? I mean, I've heard so many different, methods of really cleansing the skin and keeping it moisturized. What is your recommendation?
Yeah, for a general skincare regimen, I would say probably the most important 1, 2, and 3 things are really good sun protection, number one. So we tell people all the time that if individuals were vampires or hid from the sun all the time, we'd be able to stop a lot of the different changes that we think about related to the sun in terms of risk of conditions and aging and wrinkling. So just really good protection in that regard. Obviously, regular moisturization. I don't tend to be a stickler on sort of what specifically, as long as people think about moisturizing regularly, usually with creams and ointments rather than typically lotions. And then as far as you mentioned washing goes, there is a risk of overwashing too, in terms of really stripping away some of the valuable lipids and oils that we have on our skin. So typically gentle cleansers used daily are sufficient for that type of process. And beyond that, that's kind of your basic important approach. But really just doing a good job with the fundamentals can oftentimes go a long way rather than some of the more fancy stuff.
So I know you have a lot of teenagers, or is there such thing as called teenage acne, where you're coming in and the patients that you're caring for, you have a lot of blackheads or whiteheads that you are caring for. Do you see that often? And do you recommend you self-care with blackheads and whiteheads or teenage acne, and there's also adult acne? Or do you recommend us coming in to getting those, taken care of by the dermatologist?
Yeah. So I think that the short answer would be that is definitely a good reason to seek out a dermatologist, just because there's a whole host of things that could be going on that potentially results in what appears like whiteheads, blackheads, or even bumps on the skin as well. And like you and I were talking about, a lot of rashes can look very similar, even though they have distinct etiologies. And so that's one place where simply just self-care maybe is not going to be enough, and you want to have someone help make a diagnosis so you could get the right treatment no matter what is going on.
And skin tags, just the moles and skin tags that you may get, do you recommend removing them? As you get older, I notice that they appear more, a lot of the moles and the skin tags. Do you recommend removing those?
Yeah, so I've always been a less is more guy. And I think that rather than sort of necessarily dispense vague medical advice, I would say that any type of lesion on the skin, whether it looks like it might be a mole, a skin tag, a bump, or a cyst, it's hard to tell exactly what it is unless it's something you see day in and day out. So sort of the underlying undercurrent in our thread of discussion, whether it's a rash like seborrheic dermatitis,
Right.
questions about other changes on your skin, even lumps or bumps as well, a dermatology healthcare provider is going to be the source to really discern if this is something that needs further workup or not, because the vast majority of benign lesions on the skin we're typically not going to do anything about.
One other thing, melanomas, when you see, what does that look like? And I know it's a sort of a change in the color of the skin. People who stay in the sun are more predisposed. How serious is a melanoma?
Yeah, so melanoma is one of the more serious types of skin cancers we deal with, not only in dermatology, as well as sort of overall medicine itself. And while I don't necessarily purport to be a specific expert in melanoma, the one thing I can say that, it's very important for individuals at risk or individuals that have a history of skin cancer itself to really seek out regular screening for some of those changes you mentioned in terms of changing color, size, appearance of lesions on the skin, which can oftentimes be an early harbinger for melanoma itself.
So it's interesting to think that across the lifespan, we all can experience some changes in our skin. And so the bottom line is, just like you see any other doctor, it's very important that you go in to see dermatology.
That's a nice way to sum it up.
Yeah, to make sure that the skin changes that you are seeing are supposed to be happening. So one thing that you want to leave us with, just one thing, if you can think of it.
Yeah. Well, I think that, again, I'll tie it back to the first part about our conversation. I think that just given the millions of individuals that have this condition, seborrheic dermatitis, and many of the listeners here may not even be super familiar with the term or the symptoms itself, I think that there's a lot of ways to learn more about it. And so I had mentioned that, to see if Zoryve foam is right for you, ZORYVE, or even thinking about the disease itself, talking with your dermatology healthcare provider about the signs and symptoms you're experiencing, visiting Zoryve.com to learn more about the medication and the disease itself. But overall, if you feel that your skin is not at its normal state and some of these symptoms sound familiar, just seeking out a healthcare provider to make sure you get to the right place so you can actually get treatment for a highly burdensome condition that really gives individuals a lot of quality of life changes.
Well, we want to thank you for this very informative time. And thank you for being here, Dr. Raj Chovatiya, a board-certified dermatologist and the founder and director of the Center for Medical Dermatology and Immunology Research in Chicago. We thank you for giving us this so important information, and we hope you continue to stay healthy and continue doing the great work that you're doing.
Thanks so much for having me.
You are welcome. This is Dr. Jeanine Cook-Garard, and we are from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.